Welcome. I'm Andrea Clessy for Women's Hospital. Genetics is a growing medical field that provides patients a glimpse into their potential medical future. Dr. Duane Superneau explains how genetics and medicine work together.
I'm Duane Superneau and I'm a medical geneticist. Medical genetics is a field of specialty that deals with inherited diseases, working for individuals, patients, and their families, particularly determine, for example, if a baby is born with birth defects, why did it happen, what does it mean, what are the implications, what can parents expect? Is it in the genes? Could it happen again? Individuals may come in and want to know, am I at risk to have a baby with birth defects or problems? Or if there's a particularly difficult disease in the family that may have a genetic origin, did I inherit that gene? Am I at risk for having that disease? The field of medical genetics is not new. Perhaps we might say in the last 3 to 4 decades it's become more organized as more genes are being discovered. Then the individuals who deal with medical genetics have assumed a more prominent role in the medical specialty field. An individual, a patient, their family may come to a medical geneticist to determine why a baby in the family was born with birth defects. Could it be genetic? Might it run in the family? Could it happen again? Individuals may want to know, am I at risk for a genetic disease, an inherited problem? And if there is a known problem within the family, did I inherit that disease? Did I inherit that gene? And am I at risk to express that at some point in the future? And could I have that particular problem? For example, inherited cancer. Genetics goes a little bit further to discuss with families, individuals, what they have, what does it mean, what are the implications, what does it mean for their children if it should be passed on to the next generation. And that particular area is known as genetic counseling. Genetic counseling basically is having individuals receive a medical education about the particular genetic process within the family. Genetics is becoming more popular, more to the forefront of medicine now because we are discovering genes. In the past, we knew problems may run in a family, but we had no specific identification of that gene to be able to determine who had it, who didn't. But with latest technologies and abilities, we're able to determine the precise mutation of a gene that may cause the process within the family, and then we can track that particular mutation through individuals to know who is at risk and who is not at risk for having such a problem. Medical genetics is going to assume a more and more prominence in the field of medicine because as we discover different genes for different processes, we'll be able to give individuals a direct diagnosis about their particular risk to have this disease. And of course, we can reassure individuals they did not inherit the gene and their risk for such a disease may be simply chance. As we discover more and more genes and have more and more capability, we're going to figure out what are genes doing wrong, what might the body be lacking because of this gene mutation, and to develop strategies to treat. That is, to replace the missing product or to block the bad effect. And as we do so, we'll have a better opportunity for direct and specific treatment for processes, perhaps even a direct and specific process for preventing cancers.
For more information, visit womans.org. Womans, exceptional care centered on you.